Hello, thank you for allowing me to take a few minutes of your time. My name is John Raitt, and I'm here with SHINE, which stands for Serving Health Insurance Needs of Elders, and SMP, the Senior Medicare Patrol Program. In today's presentation, I will talk to you about Medicare fraud and abuse, how they affect you, and how you can take charge to help prevent fraud and abuse in 3 easy steps. 1, protect. 2, detect. And 3, report. SHINE is a program of the Florida Department of Elder Affairs. The SHINE program is part of the nationwide state health insurance assistance programs, also called SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs' vision is all Floridians aging with dignity, purpose, and independence. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. The SMP mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. The Department of Elder Affairs administers programs and services for elders through contract agreements with 11 Aging and Disability Resource Centers in Florida. The centers are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with Aging and Disability Resource Centers to provide counseling services locally. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, and compare or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, also called Medigap, extra help for prescription drugs, Medicare fraud and abuse, Medicare savings programs, long-term care planning, Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. You might be wondering why I should care about Medicare fraud. Well, Medicare fraud, errors, and abuse affect everyone. Each year, Medicare loses billions of taxpayer dollars to improper claims. This puts the Medicare Trust Fund at risk for everyone and affects the future of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. Medicare fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or by someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. Medicare numbers are for life, even if stolen or misused. So a Medicare beneficiary whose number is compromised may be affected forever by false claims against his or her Medicare number. Receiving healthcare from a fraudulent provider can mean the quality of care is poor. The intervention is not medically necessary, or worse, the intervention is actually harmful. A beneficiary may later receive improper medical treatments from legitimate providers as a result of inaccurate medical records. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed Medicare benefits. Medicare numbers are as valuable as Social Security numbers to thieves who wish to set up credit card accounts with someone else's identity. Financial fraud can be a side effect of having one's Medicare number compromised. Also, there may be legal consequences for beneficiaries who are complicit in fraud and abuse, since participating in schemes to defraud Medicare is illegal. The Senior Medicare Patrol is here to help you avoid these problems. Senior Medicare Patrol programs, or SMPs, help Medicare and Medicaid beneficiaries prevent, detect, and report healthcare fraud. By doing so, we help preserve the integrity of the Medicare and Medicaid programs. Because this work often requires face-to-face contact to be most effective, SMPs nationwide rely on approximately 5,000 volunteers who are active each year to help in this effort. Medicare fraud involves intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. Next, what is Medicare abuse? Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet professional standards. Medicare fraud and abuse are very similar and many times overlap. Here are some examples of Medicare fraud and abuse. Billing for services, supplies, or equipment that were not provided. Billing for excessive medical supplies. Obtaining or giving Medicare number for free services. Treat any offer of free services in exchange for your Medicare or healthcare identification number with caution. Improper coding to obtain a higher payment. Unneeded or excessive x-rays and lab tests. Claims for services that are not medically necessary. Using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. So what can you do to take charge and help prevent Medicare fraud, errors, and abuse? I'm here to tell you in 3 easy steps: protect, detect, and report. First, protect yourself and your loved ones from Medicare fraud and abuse. Do treat your Medicare and Social Security cards and numbers like your credit card. Don't give out your Medicare number except to your doctor or other Medicare provider. Don't carry your Medicare card unless you will need it. Only take it to doctor's appointments, visits to your hospital or clinic, or trips to the pharmacy. Do watch out for identity theft. Scam artists will not only use your Medicare number to defraud the Medicare system, but this is also one way that people can steal your identity. Do be aware that Medicare doesn't call or use or visit to sell you anything. However, Medicare does now require that contractors to contact beneficiaries from time to time, so make sure to be vigilant. Keep in mind that you don't have to talk to anyone who calls you or shows up at your door who you do not trust. Medicare contractors will understand. Do be cautious of offers for free medical services. If it sounds too good to be true, it probably is. Do pass it on. Share this information with friends and family members who might not already know how to prevent Medicare fraud and abuse. Second, detect Medicare fraud and abuse. Even when you do everything right, there's a chance that you could be a target of healthcare fraud. There are many ways that your personal information can be used without your permission. Record doctor's visits, tests, and procedures in your personal healthcare journal or calendar. Always review your Medicare summary notice and explanation of benefits for mistakes. Look for 3 things on your billing statements. 1, charges for something you didn't receive. 2, billing for the same thing twice. And 3, services that were not ordered by your doctor. Compare your Medicare summary notices and other statements to your personal healthcare journal and prescription drug receipts to make sure that they are correct. Access to your current Medicare account is available 24 hours a day at www.mymedicare.gov. Third, if you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims and help to save your Medicare benefits. To report your concerns, first, if you have any questions about information on your Medicare summary notice or explanation of benefits, call your provider or plan to find out if it was an error that they can correct without taking any further action. If you are not satisfied with the response you get or are not comfortable calling your provider or plan, gather all of the facts that you can about the situation. Make sure you have your MSN or EOB and any other supporting documentation that shows the possible fraud or abuse. Then contact your SMP if you need help. Please keep in mind that services provided by your SMP are free and confidential. So what you do to take charge and help prevent Medicare fraud, errors, and abuse. I'm here to tell you in 3 easy steps: protect, detect, and report. SHINE counselors offer free and unbiased assistance to help seniors identify, understand, compare, and enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medicare prescription drug low-income subsidy, Medicare savings programs, long-term care planning, insurance and financing, other public and private health insurance. If you have any questions or comments, please complete a short survey, and you'll see on the screen our website, https://tinyrl.com/survey4SHINE. Or you can contact the local SHINE program in your area.